Hi, welcome back to the profile where we tell stories to inspire, motivate, and empower through voices. My name is Christine Senga, and today we want to talk about mental health, about the myths and facts about it, because many people are living with these issues, and the others are assuming they are when they're not. With us today is Dr. Mark from Ginger Recovery Center, and he's going to be sharing a lot and more about mental health issues, conditions, and disorders, and much more terms as he's going to be explaining to us. Most welcome.
Thank you. Prince Minjo Peter Mark, Director Ginger Recovery Center. And Ginger Recovery Center is a treatment and rehabilitation center. We are located in the heart of Ginger City, where we base to help people with mental health disorders, people with addictions, say alcohol addiction, other people call it alcohol dependency, drug addictions, and amongst the drugs we have many categories like the sedatives, we have stimulants, we have amphetamines, and others. So I think in today's program we shall be talking about various categories of drugs which people are struggling with out there. And at Ginger Recovery Center, we also help people with mental health disorders. That's like depression, trauma, stress, anxiety, schizophrenia, and other mental health disorders. So our main role there is to help people restore the lost hope. Because when people are addicted to these substances, or when people are struggling with these mental health conditions, totally they lose hope in themselves, and even their family members do lose hope in their patients. So that's why we decided to come up with that center and help people. Because recently there was the statistics that was published. There was a research that was done by Butabika, our mental health national referral hospital, which showed that 30% of Ugandans are struggling with these mental health issues. Then the next statistics showed that 14 Ugandans are struggling with these mental cases. Then the recent one showed that 1 in 4 people, 1 person in 4 are struggling with these cases. So as Ginger Recovery Center, we are on ground, we're helping people restore their lost hope. Yes.
So in today's society, many people have what they perceive as mental health, and
Mm.
others describe it as madness, craziness. So many things pop into someone's mind once they hear mental health. How can you define it in simple terms?
Yes, mental health is broad, but it involves in what we call emotional feelings, psychological feelings, and then the social well-being of a person. For example, we are here, and if you tend to receive bad news, there is a way you will react to that bad news. And if you receive the good news, there is also a way you respond to that. So we base on the social, psychological, and social well-being of human being to assess whether that person has got a mental health problem or not. For example, if a person spends 2 days, 3 days without getting food, automatically a mental health condition uh, can originate from that situation. Currently, people don't have money. People are looking for money in every corner. Even that can cause or trigger mental health disorder like stress and depression and other kind of disorders regarding to mental health. So Generally, people outside there should know that mental health is just a social well-being. Yeah.
Social well-being.
Yes.
Okay. So we have so many misconceptions, the
Mm.
myths about
Mm.
mental health. What are some of the things that are perceived and they are not?
No, the truth is, um, you had said that people call it madness,
Yeah.
but that's wrong, and because it creates or it brings stigma to a person with that mental health disorder. But what we should know that mental health affects all people, all people from different tribes or race, ages, because even currently we have kids who are struggling with depression. A kid of 3, 4 years are struggling with depression. Kids are struggling with schizophrenia, bipolar. So there are many mental health conditions that children are struggling with. There is autism. So mental health affects everyone. We can't say it is for old people only or for the youth only, but it affects everyone. Then another issue, uh, mental health is a condition which affects people from all, um, I can say all the tribes. It is not majorly for the Baganda or the Basoga, but for all tribes here in Uganda and even world over. Then there is this kind of perception in the people in public, which says that they attribute it to witchcraft. Yes, they have their beliefs that someone can be bewitched and run mad, but that's very wrong. And from today onwards, you need to erase it from your brains.
When someone hears that a person has been taken to a rehab and all of that, they think, oh, this person has gone mad.
Mm,
It's one of the things that we need to clarify with the people.
mm. No, when we get these people from the communities, we do what we call a psychiatric assessment and psychological assessment. So that's where that's when we are able to diagnose which kind of mental health disorder that person is struggling with. Because you can't say he was bewitched. Yet that person might be struggling with a condition called bipolar, because bipolar involves seeing mood swing. Today you happy, oh, okay, now you're happy, then after 30 minutes you get angry at some things, and you can even spend the whole week without saying hi to your spouse just because of that mental health disorder.
You are on and off.
Yes. Then we have another condition called psychosis. Psychosis can be you can acquire it genetically. Then two, there's what we call substance-induced psychosis. You get it after abusing that drug of choice for a good number of months or years. Then another one is HIV-induced psychosis. We have our sisters and brothers who are on ARVs and have been on that medication for a number of years. So if those people don't get motivation from the family members, don't get therapy from our centers, or we have AIDS Information Center, we have TASO, we have other group support groups out there. If they don't go to those groups, churches, get motivation from their pastors, reverend, and imams, they can go into that condition where we call it HIV-induced psychosis. So when a person is in that condition, gets what we call delusions and hallucinations, whereby that condition tends to cut off his mind from the reality and goes into another world whereby we'll be seeing things which are not in this world that we are in.
So that is like someone feels like they are outcasted, kind of.
Yeah, because sometimes if you tend to interact with them, their conversation is uncoordinated. You can't have uh, a conversation with that person even for 2 minutes. Then there is a way. Hallucination is it's like they hear sounds which are not in existence. Um, they feel like someone is talking to them, so sometimes they talk to themselves. Because many times we find people on the way talking to themselves, but in their actual world, they are with people. They think they are with people or
Just
animals.
imagine.
Yes. So the imagination is only. Yeah.
So is it an effect that is caused by the medicine they take, or is it just the anxiety that comes with the disease itself and how it is perceived by the society?
Yeah. As I said that if someone is on medication for some good time and he has got no motivation, he has got no supportive family, he has got no um, doesn't eat well, that's balanced diet. Eating enough food is important, by the way. Eating balanced diet and enough food is
Is it
important.
also connected to the mental health?
Yes, because when you visit our centers, like here in Kampala, we have a center called Healing Energy Uganda in Kamocha. In Ginger, we have Ginger Recovery Center. So if you visit those centers, you can interact with the clients themselves.
So what if they are given much food? Is it also a problem?
No, we encourage them to eat a lot of food because when they were in active addiction, uh, um, they had no appetite. In fact, we admit these clients when they are completely lost their appetite. Because if a family tries to abandon someone, it means it's not going to be fed well, it's not going to be taking enough water, it's not going to be having what we call self-care. So when we get these people in our centers, we try as much as possible to give them enough food and even medication for appetite. Yeah.
I think this is something most people don't know, that actually food can also be part of it.
Mm.
Just like it is now something I've learned.
I can say food, having enough food is a therapy in our centers. Yeah.
Okay, so COVID-19 came with a lot of challenges in different fields and affected people's lives, their finances, their families. How did it affect the current state of mental health
Mm.
in the country?
Yes, COVID-19 came in and everyone was affected in various ways. So, in our field of mental health, many people lost their beloved ones, and up to now they are still grieving because many of them lost their breadwinners. Many people lost their jobs during COVID time. Many people lost friends. Many people lost property during COVID time. So there are things which happened during uh, the lockdown, and up to now, people have not restored the lost hope that they had. Yes, and when you look at the statistics from the COVID time to date, you find that before COVID, we're moving on well. Then COVID came in, and we had many cases in the rehab centers because people who used to wake up to go for work, so during COVID time, they could wake up and watch TV.
Yeah.
They could wake up and eat food only. They have nowhere to go. So only that can affect a person's well-being. So um, then mental health cases started from there, because our president started with 21 days, 14 days, 42, like that. Then by the end of the first lockdown, find that many people had lost jobs. People went into depression, because when you lose a job, you can go into depression, that condition. Then there is a condition called stress, anxiety, and many other conditions. So cases from lockdown went up, and up to now we are still struggling with those results of lockdown.
I mean, I can't just imagine someone who like didn't have family at that time. Like someone is caught up maybe in a different country, they went to work, and now they have to be locked in the house alone. The family is also somewhere else. So yeah, I think that is something that brought in a lot of even loneliness. So what kind of disorder comes with loneliness?
Yes, there are many. One is anxiety. So being anxious, or that's a state of having excessive worry of what is most likely to happen. Because you are in another country, then you hear bad news in your country that you lost a relative. Actually, you would wish to fly back to Uganda and give a farewell to your relative, but it wasn't impossible. So it creates anxiety. Then two, stress. Then three, depression. Because depression starts from a period of 14 days onwards. So depression starts from, I can say stage one is stress. Then stage two, depression.
So if it is less than 14 days, it's not called depression.
It is stress.
Oh,
Mm.
okay.
For example, when we've been taking back our children to school, so you find that a parent can just get anxious and stressed that period of looking for scholastic materials and school fees. After them reporting back to school, the situation normalizes.
So they have not gone to the stage of
Deep,
depression.
no, children can't cause that to the parents.
Okay.
Yeah.
So how has social media impacted on mental health issues?
Social media, I can say it has caused a lot of harm than good.
Mm,
Because if you look at your WhatsApp
yes.
and visit people's statuses, you'll find that there are people who are struggling
Mm,
uh, with mental health issues, but they tend to express their feelings on WhatsApp.
mm,
Then you go on TikTok, you
mm,
go on other social media platforms.
mm,
So people are not seeking for mental health professional support, but they just use their social media
mm. Express.
to share their feelings, and it's not good, by the way,
Mm,
because by the moment you post that you've separated with your, say, your spouse,
mm.
your girlfriend, or your fiance on Facebook, TikTok, you will not get any positive response from.
I mean, you have people judging, others
Yes,
blaming you.
yes, because when you go to the counseling firms, the rehab centers, hospitals, or churches, they only give you the professional side of support.
Mm,
Yes, because when you come to Ginger Recovery Center, when you go to Healing Energy Uganda, when you go to Butabika, they only give you therapy and medication,
mm,
whereby you can be relieved from that condition that you're struggling with.
mm,
Yes. So social media I can say it's good or it's bad. It has got the good effects and the bad effects at the same time. Yeah.
So in that case, we have the people around us, the surrounding, have have talk. They have what they talk about
Mm.
mental health. How has society contributed to its existence? How has it contributed to maybe trying to mediate between these conditions as a society?
Um, Society has not embraced this issue of mental health, and many people uh, they know that mental health is a virgin field now, because previously we had one facility in Uganda, that was Butabika.
Mm,
Then other private centers came in, like Center Center. It is a rehabilitation center along Entebbe Road. We have Hope and Beyond. We have Listening Ear Foundation. We have Life Back Foundation. Currently, we're having Healing Energy Uganda. In Busoga, we have Ginger Recovery Center. So, formerly, people were not aware that mental health is a problem in Uganda. Little did they know that people were dying due to lack of knowledge about mental health. But currently, we've tried our level best, and the community has started to embrace uh, and appreciate the energy that we have invested in this. Because if you look at Busoga, generally we have main hospital, that's Ginger Main Referral Hospital, and it has got the mental health unit. But it is not doing its best, because this is the truth on the ground. When you go there, and when a person is in uh, a bad state, they will sedate that person. Then, after a few days of that person stabilizing, they discharge. But the truth is, if a person is bad off, it means that person needs ample time at the hospital. Because, to give you an example, for a person who is addicted to alcohol only, when you go to these private facilities, and according to World Health Organization, you will do your research, we give that person a minimum number of days, 90, to be treated and rehabilitated. And after those 90 days, we can verify and say this person is good to go and join the outside world. Then for a person who is having a multiple usage of substances, that's for example cigarettes, cocaine, heroin, cat, marijuana, and others, we recommend that person to be rehabilitated for 6 months. That's 180 days when he's in there for treatment and rehabilitation. Because our treatment involves in detoxification, which takes a period of 14 days to a month. Because we also carry out what we call organ function tests. Because for a person who has been using these drugs and alcohol for a good number of years, it means the internal organs might be affected. So we also carry out those organ function tests to verify whether the heart, the kidney, the liver, the lungs, the pancreas are in a good state. After detox, they embark on the treatment for these other organs. Then therapy comes in. Among the therapy we give in the rehab centers, we have what we call cognitive behavioral therapy. We have experiential therapy. We have life skills, spiritual development programs, youth mentorship. So there is a lot in the centers, yeah, which hope those people to gain. So when we get back to our community, we doing what we call community sensitization, because many people, when you're looking at the the myth, many people attribute it to witchcraft. So we are having a lot of workload for us to inform the community members that let's stop attributing mental health to witchcraft. So in Busoga region, we've been invited and given free airtime on various radios, and we are doing our level best. Yes.
But about the witchcraft,
Mm.
in the medical term, is there such as witchcraft as a cause for mental illness?
No, it is just a myth. In medical, we have facts only. Yes.
So, what are some of the early signs that can tell someone is facing a mental health condition?
One is isolation. A person with mental health condition will start to isolate him or herself from the public. You find someone hiding, someone dodging family events or social events. Then two, we can look at losing appetite. Someone can even spend a day without eating. There, you can verify that this person is struggling with a certain kind of condition that needs attention. Then three, there are people who tend to overconsume alcohol, because this is also in people who are not addicted. For example, you in a relationship with your fiance, then he checks you, you end up going to a bar. You 40 years, 30 years, you have never taken any drink, but because of this kind of disappointment, you end up in a bar, you buy beer for
One of the misconceptions also that beer is medicine.
yeah. You end up consuming a lot of alcohol. It is also a sign. Then there are people who tend to lose hope. I don't want to say that they go into that situation of being hopeless, but that is the truth. And there are other conditions, yeah. Mm.
So when you identify that from maybe a relative or friend, what are the immediate things that you need to do? Maybe you are not able to afford private hospitalization at the time. What are the immediate things you can do that are affordable at hand?
Yes, thank you for that good question. If you have a relative, a beloved one, a community member that is struggling with these mental health conditions, the first step you could take is to take that person to the nearby facility. You can take that person to a clinic. You can take that person to a government facility like Health Center 2, 3, 4, because there they get free medication. Then at regional levels, like in Busoga, we have Ginger Referral Regional Hospital, we have Mbale Regional Referral Hospital, and even other hospitals. You're free to take your relatives there for attention, because they tend to get free medical attention from those mental health units. Then if you see that the situation is not good, then you ask for a referral to Botabika, our national hospital, mental health hospital. Then there are people with some money. We have many private rehabilitation centers. And the treatment that you'll get from the private rehabilitation centers is what you call detoxification and other therapies. So you're free to bring your relative to Ginger Recovery Center if you're in Busoga and East. Then here in Central, we have Healing Energy Uganda and others. So feel free to contact those centers, and your beloved one will get rehabilitated and treated well.
I mean, most people are afraid of approaching you people. They think you're very expensive. I have a friend who was going through a situation, and then I told them, why don't you just go for therapy? Maybe it's like, oh no, I can't afford the
Mm.
money. How affordable or unaffordable are the prices of these sessions?
Yes, um, hmm, we have what we call professional support that we offer.
Mm,
And remember, these are private facilities.
mm,
Being private, it means you need to incur in some money, then you are able to get the services.
mm.
So each rehab center has got its own fee structure.
It's not scary as we
Yeah,
say.
it is not, because there are people who are just struggling with the simple psychological issues. You can seek for a session, just a session.
Mm,
A session goes for 45 minutes only,
mm,
45 to 1 hour.
mm,
And other centers, they charge 50,000, others charge 100,000,
mm,
others 150, others 200, others 300. So it depends on the center
mm,
and the way you have approached.
mm. I
Yeah.
think there is this saying that is trending: if we listen, we don't judge.
Mm.
So sometimes you just need someone to listen, and you'll be okay.
By the
Well,
way, even in churches, they are giving counseling.
mm,
Even pastors do ask you for money. Yes, you give your offertory in the morning, then in the evening or during weekdays, they have got those designated days for counseling. And I think the cheapest is 100,000. Yes.
well, that's just something that we need to embrace
Mm.
as society and make it a part of our lives. Because when you look at in the Western world, it is a norm.
Yeah.
While here, you feel like, oh, someone who goes for that session is a very rich person.
Mm.
So there are habits that are considered to be good habits
Mm.
and bad habits. What are some of those habits that can help someone support their mentor?
One is getting a way to relax. So when we talk about those activities, we in there we have like meditation, we have what we call mindful meditation,
Mm,
we have mindful. Then another meditation is for people with addictions, whereby we start with having the thought for the day.
mm,
Uh, Majorly talks about the life that you in during active addiction.
mm,
Then we go for meditation for the day. Specifically, it is
mm,
spiritual. Talk about God. Then we pray. Then another way is you can go for yoga or aerobics.
mm,
It can it can help you relax. Then in the other one, you can go for what we call a nature walk.
mm,
Other people call it recovery walk. You can spare some 30 to 1 hour moving on the forest or on the road
mm,
as you think about your situation and how you can overcome that situation. Then in the other way, you can read your book, motivational book. You can go for a game of your choice. Among the games, we have the Ludo, we have playing cards,
yes.
chess, darts. So there are many games that you can have, or you can go for a gym. Because when you go in for gym, there are people that you can share with and work out with. It can help you to relax. Then another point, um, you can go for prayers.
Mm,
So churches have got special prayers for such kind of people. You can go for Bible study. It can help you
mm,
uh, get motivated.
mm,
Then in the other point or issue, you can go for medication.
mm,
Yes, medication or a therapy. When you talk about the therapies, there are many
mm,
types of therapies. In counseling or in psychology, we don't call them counseling, we call them therapies.
mm.
Yes.
So there are just simple things that you can adopt to, but people choose not to. But today you can choose to take. adopt to those daily habits
Yes,
for
and
your own.
I think this one is also important. They can go for a good balance diet. Yeah, and taking a lot of water. It can help them get well.
So, doctor, how do you manage to handle so many cases of people with mental health issues? You as yourself, how do you make sure your mental is stable after dealing with so many people with such issues?
Yes, one, I practice what we call self-care. When we talk about self-care, it comprises of emotional self-care, it comprises of spiritual self-care, um, economic self-care, social self-care. So you first need to understand yourself first, because if you don't have that physical self-care, it means you can't help someone get well or restore the lost hope. One, you take care of yourself. Then two, um, we read. We read a lot because every client has got his or her own experience. Today you are receiving a client who is addicted to alcohol only. Tomorrow you're getting someone who has been disappointed by the husband. The other day someone has lost a job. The other day someone has lost something. So it means you need first work on yourself, then you can be able to help another person. Then another issue, we travel, because it is also a way of making ourselves relaxed. We do what makes us happy, although we don't drink, but we look for those activities. We do everything out of passion. Yes. So without passion, you can't work in a rehab center. So in rehabilitation centers, we have people like the security people. By the way, a security man who is working in a rehab center can't work at a hotel, because he's there with passion to help those people recover fully. Even the chefs that we are having in the rehab centers, you can't compare them to chefs that are in hotels or in restaurants or in schools. So the people that who are working in rehab centers, I can say they are special and gifted people from God. Yes.
With the current state of our society and their belief and knowledge about mental health, what advice or what word what would you tell society, people out there, in relation to that mental health?
One, I'd like everyone to be vigilant about the way the neighbor, the relative behaves, because you might be having a relative who is struggling with the mental health and you're not aware. Then two, if you come across anyone with the mental health disorder, try to give that person a good reception, because if you don't treat that person well, it will continue to affect his or her mental state. And three, if you have that person, take that person to the nearby facility for medical attention. Yeah.
Thank you so much, Doctor, for your time and for taking care of our people
Welcome.
out there, because so many people are actually going through these situations, but they are seated, they are quiet, and some of them are afraid to come out.
Yeah.
Someone is like, how are they going to see me in a rehabilitation center? One thing I can tell people is that do not be afraid. Just go for it. If you feel like something about you is not right, something about your mind, about your thinking is not right, seek out help. It does you no harm when you seek help, because we have people like Dr. Mark that are willing to support. that are willing to listen and find a solution to whatever it is that you're going through. Because today it might be something simple, and tomorrow it will escalate into depression. It will escalate into something that is going to cost you higher than what you expected to treat today. Thank you so much for being part of our show today and for the time that you dedicate to us. We are being sponsored by News Media. You can find them on all their social media platforms at News Media for car video coverage or photography and other media related services. You can also contact them on 07548202449. And don't forget to follow us on all our social media platforms at Musenga Christine. Until next time, bye.